everyone, welcome back to Dr. Shravani's Med Concepts. This video is on causes of cell injury. Please watch entire video and answer the MCQs provided at the end along with your valuable feedback in the comment box. What are the causes of cell injury? Sequence of events occurring when a cell is exposed to an injurious agent or stress is known as cell injury. Causes of cell injury can be genetic causes and acquired causes. Acquired being hypoxia, which is because of oxygen deprivation, infectious agents, immunological reactions, nutritional imbalances, physical factors and chemical factors. Of all the causes of cell injury, hypoxia is one of the most important cause of cell injury. What is hypoxia? Inadequate oxygenation of tissue is known as hypoxia. So, it is the most common cause of cell injury. What are the various causes of hypoxia? It can be because of reduced blood flow as in ischemia, decreased oxygen carrying capacity of blood as seen in anemia and carbon monoxide poisoning, inadequate oxygenation of blood seen in cardiorespiratory failure. What is the most common cause of hypoxia is ischemia. Don't get confused here. Ischemia is the most common cause of hypoxia, while hypoxia is the most common cause of cell injury. First cellular change in hypoxia is mitochondrial dysfunction causing decreased oxidative phosphorylation and decreased ATP production. What are the various effects of hypoxia? There are certain organs and tissues in our body which are highly sensitive to hypoxia, like CA1 region of hippocampus and neurons. The organs and tissues which are more resistant to hypoxia are fibroblasts and skeletal muscle fibers. The effects of hypoxia depends upon the extent of hypoxia. If mild hypoxia is there, the tissue will go for cellular adaptation. As you can see here, you can see the atrophied limb on one side and the normal limb on the other side. It is because of mild ischemia which has caused atrophy of one limb. If there is severe hypoxia, it can cause cell death. Here you can see there is severe hypoxemia because of ischemia leading to ischemic necrosis. Immunological causes of cell injury can be mainly of two types. One is autoimmunity and allergic diseases. First we will know about autoimmune diseases. What exactly is it? There is autoantibody production, means antibodies against the self antigens are produced which destroy the self antigens, thus causing destruction of the normal tissues present in our body. So that is autoimmune diseases pathogenesis. The examples of autoimmune diseases are SLE, rheumatoid arthritis, Hashimoto's thyroiditis, myasthenia gravis, and the list is so big. So in this what happens? There are immune reactions to endogenous self antigens. Other immunological cause of cell injury is allergic responses. So some people will be allergic to pollen, dust mite, drugs, peanuts. In these people what happens is there is heightened immune reactions to many external agents. Nutritional imbalance also can cause cell injury and it is one of the underrated cause of cell injury. It can be nutritional deficiencies and nutritional excess. Here you can see lack of intake of carbohydrates resulting in marasmus leading to malnutrition and decreased intake of proteins can result in kwashiorkor. There is a diagram showing various vitamin deficiency disorders. Excess of nutritional intake results in obesity which in turn results in so many disorders like hypertension, hyperlipidemia, insulin resistance which in turn leads to diabetes. And increased intake of lipids causes deposition of fat in the blood vessels causing atherosclerosis which in turn leads to decreased blood flow to the heart resulting in MI, that is myocardial infarction, which is known as heart attack and it is the most common cause of death nowadays. Take 1 second and interpret this picture. Okay, what is it? It is anorexia nervosa. It is a psychological disorder of inadequate food consumption. Here as you can see the patient or the female is obsessed with her appearance in the mirror. So she is able to see herself as an obese woman. So thinking that she will eat very less, she will go for intense workouts and in that process she will have distorted body image. But in spite of that she will think that she is obese and do still more intense workouts. So this is a psychological eating disorder. Coming to physical causes of cell injury. Various physical causes are mechanical trauma or pressure and extremes of temperature like extreme cold, burns, radiation injury, electrical shock. Infections as cause of cell injury. There are so many viruses which causes cell injury, and most important thing is COVID virus. We know how the entire world suffered with COVID virus. There are certain bacteria, fungi and parasites which can cause cell injury. Coming to the genetics causes of cell injury. Presence of extra chromosome in the 21st position, that is trisomy 21, causes Down syndrome, which is characterized by so many symptoms like upward slanting of palpebral fissures, single palmar crease, hypotonia of the muscles, flat nasal bridge, which is characterized by trisomy 21. Sickle cell anemia, which is because of single base pair substitution, is also another example of genetic cause of cell injury. In this, what is happening? The discoid shape of RBCs are getting transformed into sickle shaped cells. Inborn errors of metabolism causing deficient protein function is also another example of genetic causes of cell injury. Chemical causes of cell injury includes toxins, drugs, heavy metals and reactive oxygen species. Sometimes what happens is glucose and salt, which are normally essential for our body metabolism, if present in hypotonic concentrations, causes cellular osmotic balance disruption leading to cell injury. So, increased glucose present in the blood causes diabetes, and increased salt intake and salt imbalance causes hypertension. Reactive oxygen species is another chemical cause of cell injury. Coming to the toxins and poisons, various chemicals like arsenic, cyanide, mercury, these inhibit cellular respiration and disrupt metabolism leading to rapid cell death. On-spot death occurs, especially with cyanide. You might have seen in some movies, they will ingest the cyanide causing sudden death. Another one is carbon monoxide. It binds to hemoglobin, reducing oxygen delivery and thus causing hypoxic injury to the tissues. Therapeutic drugs, when taken in excessive doses, also can cause injury. Alcohol can cause liver cell damage through oxidative stress and metabolic disturbances. Even oxygen also at high concentration lead to oxidative damage. So this is a summary of various causes of cell injury. You can have a glance, and these are the MCQs which I told you in the starting. So you try to solve them. After hearing the entire video, you will know how you have understood the topic. I request you to give your answers and as well as feedback in the comment box. Thank you.